I think even before that, you should think about what is your vision of practice, you know?
So I think one of the things I kind of go with what I normally recommend dentists do, and that's first and foremost, find a niche that they want to be very specific with. I was talking to my sister, who's also a dentist, and and she was telling me about an associate that decided she wanted to start her own practice. Didn't really get it vetted. She didn't think she was ready at the time, but she went out and bought a practice, acquired a practice, but it was she's African American, born in a white neighborhood, didn't really get the whole thing vetted. The 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 patient flow when the doctor left, took the patients with her. She went and invested a lot of money and so forth. So I think a plan for having that the niche and everything worked out. But after that, it's actually location. So with that, the demographics and so forth, then it's location.
So location, I think, you know, you hear it, location, location, location. It's everything in terms of where you're going to pull your potential patient population from, because your dental practice, in large part, is going to anchor you to a certain community in terms of where you're going to drive to, the type of demographics in that community, and you have to figure out, is it within a reasonable distance of where you want to live? I think is very important.
Right.
So, you know, take location into consideration in terms of your demographics. Are you going to be a fee-for-service practice, chimo practice, a dental practice? Are you going to do high-end cosmetic work? Are you going to have, you know, 12 operatories and be filling them up and doing a lot of work that way? Location is important in terms of, you know, how you want to practice. But I think even before that, you should think about what is your vision of practice. You know, that's how I start my book is what is your vision of practicing dentistry? How do you want to do it? If you are a doctor who's going to treat a lot of families, so being in a mall where there's a lot of visibility is probably pretty important for you. But if you're a specialist, right? Endo, perio, you know, you can be in medical building because most of your patient flow is going to come from a lot of referrals. So, you know, think about the vision and then work backwards.